Number 1. To whom does the normalization principle apply? The answer is, the normalization principle applies to all people with developmental or intellectual disabilities, regardless of severity or location. Number 2. What does the NP focus attention on? The answer is, the NP focuses attention on what the person who is disabled can achieve. Number 3. What does sensitivity to the NP prevent? The answer is, sensitivity to the NP prevents devaluation and decreases discrimination. Isolation and segregation breed ignorance. Number 4. What does learning through mistakes do for the individual with a disability? The answer is, what learning through mistakes does for the individual with a disability is, it assists them in making decisions about their lives, helps them figure out which actions are acceptable in society, and prepares them for future dangers and challenges. Number 5. How is the public's perception shaped of people with disabilities? The answer is, perception is shaped by the messages the advocate or program for developmental disabilities sends. Number 6. Which living arrangements offer more opportunities for individuals with disabilities? The answer is, the living arrangements that offer more opportunities for individuals with disabilities are those with a higher social integration and community presence. Examples are group homes or shared or community living. Number 7. The psychiatric technician is describing the concept of normalization to a group of psych tech students. What would be the most important factor that would contribute to societal acceptance of the individual with a disability? The answer is, the most important factor that would contribute to societal acceptance of the individual with a disability is, greater acceptance is gained if disabled person has mastered self-help skills, such as dressing, feeding and toileting, and generally engages in behavior which is similar to non-disabled people. Number 8. Under the principle of normalization, what living arrangements would be best for adults with developmental disabilities? The answer is, under the principle of normalization, the living arrangements that would be best for adults with developmental disabilities are residences with single rooms which allow for privacy, personal dignity, and a sense of independence. Number 9. Under the normalization principle, what is the best place for a child with a disability? The answer is, under the normalization principle, the best place for a child with a disability is a family home with parents. Foster care is an alternative. Number 10. What is the best educational plan for a child with a developmental disability? The answer is, the best educational plan for a child with a developmental disability is generic early education programs which integrate the child into a regular school setting. IEP number 11. What is the ideal setting in which individuals with a developmental disability should be given meals? The answer is, the ideal setting in which individuals with a developmental disability should be given meals in a family setting, such as a dining room with people. Number 12. What is the principle that the psychiatric technician should remember when working with a client who is 40 years old and has the functioning age of 2 years with regards to age-appropriate activities? The answer is, the principle that the psychiatric technician should remember when working with a client who is 40 years old and has the functioning age of 2 years. Activities should be catered to the client's chronological age, in this case 40 years old, not their mental functioning age, which is 2 years. Number 13. A client with a developmental disability is refusing to go to the workshop assignment. What approach is best for staff to take using the normalization model? The answer is, if a client with a developmental disability refuses to go to the workshop assignment, the best approach for staff to take is to ask why they don't want to go, work through possible solutions together, and encourage them to attend. For example, offer to walk with them. Number 14. What is the first step to take by the psych technician before conducting a life skills training program? The answer is, the first step to take by the psych technician before conducting a life skills training program is to establish a baseline. Number 15. Which types of activities are appropriate when teaching life skills to an individual with a developmental disability? The answer is, the types of activities that are appropriate when teaching life skills to an individual with a developmental disability are, you can include domestic, for example making their bed, doing laundry, making sandwich. Another method is vocation, for example work-related skills, job seeking or training. Another method is arts and crafts such as music, puzzles, gardening, personal hobbies and community functioning. An example would be community trips to the mall, going to the movies or the grocery store. Number 16. What are some facts that should be remembered when developing a life skills training program for individuals with developmental disabilities? The answer is, what should be remembered when developing life skills training program for individuals with developmental disabilities is that every individual is unique. That person is a person first. Handicap is secondary. Number 17. The group leader is teaching a child with moderate mental retardation self-feeding skills. What is the first action for the group leader to take? The answer is, when the group leader is teaching a child with moderate mental retardation self-feeding skills, the first action for the group leader to take is to get them to look at the food and spoon. Getting their attention can mean tapping the spoon or bowl and telling them to look at their food, either with gestures or with verbal prompts. Number 18. The psychiatric technician is teaching a client to use the toilet independently. What are the steps that should be taken by the PT to implement a toilet training plan? The answer is, when the psychiatric technician is teaching a client to use the toilet independently, the steps that should be taken by the PsyTech to implement a toilet training plan are to establish a routine consistent with their regular bowel movement, which is usually after meals, to then ensure a consistent environment, like a private toilet, and then reinforce when elimination is completed in the toilet. They should lastly wash their hands after. Number 19. What are some considerations when implementing a toilet training program? The answer is, some considerations when implementing a toilet training program are readiness to learn, bowel movement at consistent times of day, staying dry and clean for a certain time after using the toilet, at least 2 hours, and signs of discomfort. Number 20. The group leader is planning to teach hand washing to clients on residence 29. When would be the best time to teach this skill? The answer is, the group leader who is planning to teach hand washing should know that the best time to teach them how to hand wash their hands is right after using the bathroom and before meal time.